Hello, this is our patient, Mr. Curtis, and we're going to have the privilege today to talk to him because he's a very great patient of ours, and we've been having the opportunity to help him for a number of years. So welcome.
Thank you.
It's my review of your record just recently that you have had implant prosthetics for over 11 years now.
That's correct.
And do you remember what it was like before you had the implants? What was the condition of your teeth?
Not good. I had periodontal disease. It sort of runs in the family. And the teeth condition was not good.
And if
Lots of plaque.
Lots of plaque. And if I remember correctly, we did your implant prosthetics on your lower jaw first.
That's correct.
And you have a fixed prosthetic device on your lower. Is that correct?
Lower, that's right.
And how have things changed since you had that on the lower?
Well, it's just probably the best thing I ever did. It has worked tremendously from the beginning. Very solid, no problems at all. Over 11 years, no issues, which is sort of just amazing to me. Not that I would really know what to expect, but it has turned out to be a terrific thing.
And on the upper, I think we completed that therapy not long after we did the lower.
Correct.
And on the upper, you have a implant prosthesis that is fixed when it's in your mouth, but removable also for cleansability.
That's correct.
And do you remember, I don't, do you remember why we did removable on the upper and fixed on the lower?
I don't know. I think it was your recommendation.
Right. And how has, and that's why you're a little unusual as a patient. You have a fixed appliance on the lower, but you have a removable appliance on the upper. Can you contrast the two appliances?
The lower is obviously very solid and has remained terrific with no issues at all. The upper, I occasionally had to have you or Dr. Camfield retighten the clasps because sometimes they get a little bit loose. You know, I think it's important for the removable upper to be able to clean and get food and plaque out of there. The lower you can sort of scour out with a brush or a rotodent.
Okay. And I believe also maybe once or twice I've had to remove a little tissue on the upper because there was some tissue that got impinged underneath the bar.
That's correct.
But that was very minor.
Very minor.
Very minor. So would you say your ability to eat is similar on the upper and the lower, or it's different?
It's much better than the condition of my teeth prior to the implants. So I was having real trouble, chewing food, and now there's just no issue at all. I can eat anything and feel very comfortable, biting into an apple. It's terrific. So it's much improved.
What advice or guidance would you give to dentists who might be watching this interview?
Well, I don't know what the other possible applications or procedures are, but I can just say for my case, I think this has worked out tremendously well, and I'm very pleased.
What advice would you give to patients who are considering the same options that you chose for yourself?
I would say do it. If your dentist, if your periodontist is recommending it, if your teeth are in that bad condition as were mine, I wouldn't hesitate. I mean, it is really a transformative experience to have gone from teeth and gums that were painful, and obviously had several extractions along the way, to something that's pretty much carefree and very easy. I would say life it has been very good since I had these dental implants.
Okay, well that's great information for doctors and patients, and we thank you for your time to share this information with us and other people, and we hope that you continue to get great value and service for what we've been able to help you with, and this video will help others as well.
Thank you, Dr. Duello.